Anxiety is a normal reaction to stress and can actually be beneficial in some situations. For some people, however, anxiety can become excessive and difficult to control. Too much anxiety can negatively affect day-to-day living. So, how do you know if your anxiety is normal or if you could have an anxiety disorder? First, let's start off with everyday anxiety, or in other words, times it is normal to be feeling anxious. This might include worry about having enough money to pay the bills, feeling anxious when interviewing for a new job, feeling emotional after a romantic breakup, or becoming nervous before a big test at school. Anxiety is also normal after a traumatic life event and may last longer than everyday anxiety. This might include the loss of a family member, friend, or pet, being physically assaulted by another person or animal, being in a car accident, or experiencing a natural disaster. While anxiety can be normal in these discussed circumstances, anxiety that occurs on a daily basis can actually become an anxiety disorder. Suspect an anxiety disorder if you experience constant or daily worry lasting for 6 months or more, regular panic attacks. A panic attack is a sudden and overwhelming anxiety and fear. During a panic attack, you might feel like your heart is racing and it may become difficult to breathe. You could even become dizzy or faint. You may also experience frequent nightmares or flashbacks of a traumatic event that causes continued stress upon waking. If you are anxious, you are not alone. According to the Anxiety and Depression Association of America, or the ADAA, anxiety disorders are the most common mental illness in the U.S., affecting 40 million adults in the United States age 18 and older, or 18% of the population. An even larger percentage of adults experience normal, everyday anxiety. Now, you might be thinking, okay, I have anxiety, but how is it treated? The treatment of anxiety will vary depending on the level of your anxiety and how it is affecting your life. Anxiety can be treated with several good health practices. These include deep breathing. Deep breathing increases the amount of oxygen in your brain and promotes a state of calmness for your body. Practice deep breathing at the onset of anxiety or during a panic attack, as well as consider daily deep breathing and relaxation for 30 minutes a day. Regular exercise. Daily exercise has shown to decrease stress and stimulate chemicals in the brain that make you happier. About 5 minutes of aerobic exercise can begin to stimulate anti-anxiety effects. Aim for about 30 minutes of aerobic exercise 3 to 5 days a week. This might include speed walking, hiking, running, or participating in a class at the gym. Remember to always check with your healthcare provider before starting an exercise regimen. Eating a healthy and well-balanced diet. A deficiency in B vitamins like folic acid and B12 can trigger anxiety and depression. Consider taking a multivitamin or eat foods that are rich in B vitamins. These include beef, pork, chicken, leafy greens, beans, oranges, rice, nuts, and eggs. Getting enough sleep. This is 7 to 9 hours a night for adults. Sleep is a time for your body to relax and repair. While sleeping, your body rids tension and reduces stress hormones, resulting in decreased anxiety. Anxiety is often characterized by regular negative thoughts. Positive daily self-talk can replace negative thoughts and remind you of your abundant worth. When you have negative thoughts, tell yourself, I am capable. I can accomplish my goals. My body is strong. I am learning daily. I am beautiful inside and out. And lastly, spend time with people who make you happy, including family and close friends. Spending quality time with loved ones decreases loneliness and anxiety while promoting feelings of safety, security, belonging, and enjoyment. If these discussed health practices do not decrease your anxiety, or despite implementing these health practices, you continue to have daily anxiety, you may have an anxiety disorder and require treatment from your primary care provider. In addition to your good health practices, your primary care provider may recommend counseling therapies, medications, or a combination of both to decrease your daily anxiety. Too much anxiety can become life-threatening. If you have suicidal thoughts or thoughts of hurting yourself or others, seek immediate medical attention or call the National Suicide Prevention Lifeline at 1-800 273-8255. The good news is, you do not have to let your anxiety control you. You can control your anxiety. Begin with the health practices mentioned in this video or discuss your concerns with your primary care provider. Thank you for watching and listening.